The Royal Devon and Exeter, Wanford and Hevertree hospitals have over 800 beds, employing 6,700 staff. In 2013, 197 stakeholder members were brought together in 5 workshops organised by the hospital. The experiences were subsequently analysed by Akumen software. During the workshops, members were asked to consider and discuss compassion and how it related to the world of the NHS. These discussions created hundreds of individual opinions in the form of paragraphs, around 12,000 words in total. These views and opinions were fed into Akumen's Pansensic software engine. Using the software's experience mapping functionality, the software quickly identified 5 common themes or clusters around the word compassion. They were: what is compassion? Perceived barriers to compassion? Can we learn compassion? How can we measure compassion? And compassion in the role. Akumen then drilled down into these clusters for a closer examination. For each cluster, the software produced a chart setting out the relative importance of each component element. Let's examine each cluster and component chart in more detail. What is compassion? The study found 4 key findings in answer to this question. It starts with all staff being friendly and approachable. We need to be patient with patients, understand and empathise with them, and give them the dignity and respect they deserve. We need to be effective communicators and very good listeners. We can then read the situation, understand the patient's needs, and reassure them that they are in safe hands. The next cluster related to perceived barriers to compassion. Key aspects to consider here were concerns about time pressures, with not enough staff and the need to discharge patients as soon as possible. Staff changing on a regular basis. A real worry that the organisation culture isn't compassionate from the top down. All of which could lead to staff becoming hardened over time as they try to protect themselves from the pressures and barriers. Then we consider the question, can we learn compassion? Here the top 4 aspects were a general consensus that people are either naturally compassionate or not. That's the way they are. So we need to start with naturally compassionate people, and then we can teach and raise awareness of compassion, and finally recognise and encourage people to lead by example. Well, we now understand compassion a little more, but did the members feel that it could be measured in any way? Here the Akumen analysis found 3 aspects. In our training we can observe and assess scenarios to measure responses to compassion. We can measure the patient's experiences of compassion, and we can ask the staff to observe and record compassion. So, compassion is measurable. This is a real example of compassion levels at the Royal Devon and Exeter Hospital, with 88% of patient experiences posted on patientopinion.co.uk being positive, the national average being 79%, the best 93%, and the worst 56%. So well done the Rd&E. The final cluster we examined was compassion in the role. Again, there were 4 key aspects that the software identified. There needs to be a real focus on compassion in the role because there has been less of a focus on compassion over the years because the focus has been on more professionalism. And now we need to focus on attracting naturally caring and compassionate people. Well, that's all very well, but could Akumen describe the ideal scenario? How can a hospital be more compassionate? The software analysed the 197 members' opinions and mapped what a compassionate hospital looks like. Firstly, compassion must be in people's nature as demonstrated by their ability to empathise with a friendly and approachable manner. This, together with honesty, patience and the respectfulness, form a naturally compassionate individual drawn into being caring. They have the natural ability to read situations which, when augmented by teaching ways to behave and learning on the job, create a true health professional. Not forgetting, of course, that we need to measure compassion end to end. Finally, and most importantly, Akumen were able to leave the Rd&E with 7 recommendations based on their findings. These were: firstly, healthcare starts with compassion. It needs to be a core value that grows a compassionate culture. Starting at the top of an organisation by management visibly leading the way, showing compassionate acts towards their staff. Next, there is a need to find ways to ensure staff have time to be compassionate and the pressures don't harden staff. Then, raise awareness of compassion and include compassion more in training and retraining. Next, recruit compassionate people and develop a process for recognising it. Collect patient, staff and members' experiences to observe and measure compassion, or the lack of it. Recognise, praise and reward people for kind, compassionate behaviour. And, ultimately, a zero tolerance on lack of compassion. With thanks to all members at the Royal Devon and Exeter Hospital, Jeff Chinnock, Head of Stakeholder Communications Engagement, for commissioning the study, Akumen for analysis of the experiences, Patient Opinion for the patient experiences that we measured, and, finally, SketchUps for this cartoonication.